Become our student and get access to effective and free educational materials.
Where shall I register, please?
Here. Do you have a registration card?
Yes, here you are.
Please register your information here and pay for it. And I'll make a medical record for you.
Okay, how much do I need to pay for the registration?
Please pay 10 yuan for the registration.
Here is my money.
This is your registration card. Please don't lose it and bring it whenever you come.
Yes, I will, but can you tell me how to get to the consulting room?
Go down this way until you come to the drugstore. Make a left turn and it's just there.
Good morning, is this Ryan?
You are speaking with Ryan. How can I help you?
Ryan, this is Malia, and I need to call in sick today.
What seems to be the problem?
I went hiking and have terrible poison oak.
When did you get that?
I think I got it on Saturday, but it just showed up today.
What are you doing for it?
The doctor prescribed an ointment and gave me a shot.
Good. You probably should be much better by tomorrow. Achoo.
You've been sneezing a lot lately. Are you sick or something?
No. Every springtime around April, I'm stricken with allergies.
I never have seasonal allergies.
Consider yourself lucky.
What are all the symptoms?
Well, as you just saw, I sneeze a lot. Also, my nose becomes very runny, my throat sometimes itches, and my eyes start to water.
That doesn't sound good.
No, it's not. So you don't have any type of allergies?
Well, I have a severe allergic reaction to alcohol. It runs in the family.
Everyone to some extent is allergic to alcohol.
I get it pretty bad. My whole face turns red, including my ears. My eyes become bloodshot, and I start to itch all over my body.
That's pretty bad.
But that doesn't stop me from drinking. Ahaha.
Excuse me, I want to pay the bill.
Please wait till your name is called. Okay, your bill includes the doctor's fee and the cost for a 3-day supply of medicine. It comes to 100 yuan.
Here you are.
Good. Here is the receipt. The dispensary is over there, by the way. Will this be covered by your insurance from work?
No, I'll be paying for myself, but I have private medical insurance.
In that case, I'll give you a certificate, so you can get it reimbursed.
Thanks a lot.
Don't lose this receipt, because insurance companies are very difficult about helping when they don't have the right paperwork.
What seems to be the trouble, Mr. Brown?
I'm in pretty bad shape, Dr. Ford.
Oh, in what way?
No appetite, always on edge, and I can't sleep well.
Did you lose any weight?
Yes. I have lost quite a few pounds since last month.
When was the last time you had a checkup?
About 2 months ago.
Let me take your blood pressure. You look anemic.
Well, Mr. Brown, I'm happy to say it's nothing serious.
You're just a little run down from overwork.
What am I supposed to do?
I think all you need is just a vacation.
Try to get outdoors more and be sure to get more rest.
Thank you, doctor. I'll do as you say. My doctor says that I need a blood test.
I can help you with that. Just have a seat and roll up your left sleeve.
What are you taking my blood for?
Your doctor has requested a check of your white blood count.
What information does that give him?
If your white blood cell count is off, it could signal an infection somewhere in your body.
Is a blood test painful?
I am putting a tourniquet on your arm to plump up the vein. It will only feel like a little pin prick.
Oh, my God, that hurts.
That was it. Thank you for coming in today.
Are you okay, man? You don't look very well.
I feel terrible. I went out last night with Trevor, and things got a little out of hand.
Nice. So, where did you guys go?
We hit a couple of local bars, and met up with some friends. Everything was cool until Mike came along, and it turned out that it was his birthday yesterday.
Oh no. Mike's birthday is a drink fest for sure.
Tell me about it. We drank everything in the bar.
Is that why you missed work today?
Yeah, I woke up this morning feeling really nauseous. I threw up like 5 times.
WWW.
I was so dehydrated that I drank like a gallon of water, and my head has been pounding all day. I swear, I'm never gonna drink again.
Too bad, man. Tonight is Tracis' going away party and she asked if you were gonna go.
Oh, yeah, I'm there.
I feel absolutely horrible. My temperature is 41 degrees Celsius, and I've got a headache and a runny nose.
Do you have any other symptoms?
I've also got a terrible stomach ache. Is my face still swollen?
Just a little. Has your toothache gone now?
Yes, for the most part. It doesn't feel as bad as my other ailments, anyway.
How about your tongue? Does it still hurt?
No, the burn ointment seemed to take effect right away. I think it's already healed.
How did you get that burn again?
I scalded on the hot coffee a few days ago.
You haven't had much luck lately, have you?
No, but I'm sure I'll get better soon.
When's the last time you took your tablets?
I took the red ones just before lunch and the white ones just after lunch.
I think it's time you took another dose of each. What would you like to drink with them?
Just some water, please. Do you have any ointment for my nose? It feels so itchy after blowing my nose so much.
Sure, I'll just go and get it now. What would you like to eat? Some soup?
That sounds good.
Soup always makes me feel better when I'm sick. I hope it makes you feel better, too.
Doctor, what is the best way to stay healthy?
Having a good diet is probably the most important thing.
It is very confusing to know what to eat.
You need plenty of fruits and vegetables, small amounts of protein, and whole grains.
Are there certain things that I should avoid?
You shouldn't consume too much sugar or caffeine. Also, watch your intake of fatty food.
After watching my diet, what else should I do?
You need to stop smoking, and make sure that you get 30 minutes of exercise every day.
Can I have a glass of wine now and then?
As long as you don't overdo it. A glass of wine a day should be okay.
Good afternoon, Chloe. I'm Dr. Evans. What seems to be the problem?
Hi, Dr. Evans. Thanks for seeing me on such short notice. When I woke up this morning, I had a really sore throat and a really bad cough. I think I am coming down with the flu.
Ah, I see. Yes, you do sound rather croaky. Well, let's have a look, shall we? Could you please open your mouth and say, ah?
Ah.
Good. Yes, your tonsils are a little swollen and red. How are your ears, blocked at all?
A little actually. My sinuses are a little blocked up as well. I really feel terrible.
Okay, Chloe. Can you please breathe in and out slowly for me while I listen to your chest? You really are all bunged up. You don't sound too good at all. Okay. I'm going to set you up with a bunch of antibiotics. You will need to take these orange pills twice a day and these blue pills every evening. You will also have to take this cough medicine 3 times a day after meals. Finally, I am giving you an inhaler to use every time you feel breathless just to clear up your lungs.
Whoa, so many drugs. I hate swallowing pills. Am I able to go to work?
Absolutely not. You are highly contagious. You don't want to infect the rest of your coworkers, do you? I recommend staying in bed for at least 3 days and drinking plenty of fluids so you don't get weak and dehydrated. You can catch up on all the latest TV shows and movies.
Okay, would you mind writing me a doctor's note for work? Otherwise they may think I am faking it.
Ha ha. Sure, not a problem. Here you are. Now off you go and away to bed. If you have any questions, just give me a call. Feel better soon and take care.
Thanks, Doc. Bye.
Come in and sit down, Jack. Now, what's the trouble?
I've got a terrible pain in my stomach, doctor.
I see. When did it start?
It started yesterday. I didn't eat any supper.
Have you got a temperature?
I think so. I feel very hot.
Let's see. Yes, you've got quite a high temperature.
I've got an awful headache, too, and my throat hurts.
I think you've got the flu.
Is it serious?
No, not at all, but you must stay in bed for 3 days and take this medicine.
How often must I take it?
3 times a day after meals.
Thank you, doctor. Goodbye.
Good morning, Mr. Croft.
Good morning, nurse. I want to see the dentist, please.
Do you have an appointment?
No, I don't.
Is it urgent?
Yes, it is. It's very urgent. I feel awful. I have a terrible toothache.
Can you come at 10 a.m. on Monday, April 24th?
I must see the dentist now, nurse.
The dentist is very busy at the moment. Can you come at 2 p.m.?
That's very late. Can the dentist see me now?
I'm afraid that he can't, Mr. Croft. Can't you wait till this afternoon?
I can wait, but my toothache can't. Hello, could you tell me my test results?
Your results are posted on the website. Just put in your password and you can see the exact numbers.
Are you saying that all my results were normal?
We always contact you by phone to come in if there is a need for follow-up.
How will I know what the results mean on the website?
The purpose of each test is given on the site.
Will the numbers mean anything to me?
The website will give you your results and then tell you what the normal range is.
Can I see all of my test results at once?
Yes, you can see every test for the past 5 years. You can compare them.
Hello, I need to come in and see the doctor.
Are you scheduling a checkup, or are you ill?
I have really itchy skin and think I may have to have it looked at.
Have you been feeling any joint aches with that rash?
No, but I have a low fever.
I have times available for Tuesday or Wednesday. Which one would work best for you?
I want to come in on Wednesday.
I can fit you in on that day at 10.
I would prefer Dr. Smith.
You can see the doctor of your choice then, and we will see you at your scheduled appointment time.
I have had some really horrible headaches lately.
How long have your headaches been going on?
I get headaches occasionally, but they have been really bad lately.
Any unusual amounts of stress in your life going on right now?
I am getting ready to take my GRE.
Have you been able to sleep regular hours?
It has been hard for me to sleep with a bad headache.
Has anything hit you in the head lately?
I hit my head on a cupboard door a week ago.
Let's have you come back in a few days and see how you feel.
I feel dizzy and I have a headache.
How long have you been sick?
Since yesterday. What's wrong with you, young man?
Doctor, I have a bad cough and a headache.
Do you have a fever?
I don't know, but I feel terrible.
Let me examine you. Don't worry. It's nothing serious.
Do you think I should lie in bed?
Yes, stay in bed and drink a lot of water. Your fever will be gone in a day or two.
Okay, do you think I can play football tomorrow?
Of course not. You need a good rest.
Okay, I'll listen to you.
Good afternoon. Can I help you?
I need some remedies for an upset stomach.
Are you also suffering from pain and fever?
Yes, and I also have the runs.
I'll give you some tablets that should make you feel better. One moment, please. Here you are. Take these tablets 3 times a day. Swallow them with water.
When should I take them?
Take on after each meal.
How long should I continue taking them?
Take them for 2 days. If your symptoms persist for more than 2 days, you should see a doctor also. Be sure to drink plenty of water to prevent dehydration.
Thank you for your advice.
I am dropping off my prescription to get it filled.
You can come back in 20 minutes, and it will be ready.
If I couldn't wait, could the prescription be mailed to me?
Yes, you can have it delivered or filled at any location in our HMO.
When should I take this medication?
You need to take it at bedtime.
Should I take this medicine on an empty stomach?
Don't mix alcohol with this medication, but you can take it with or without food.
What are the side effects of this medication?
You might feel a little dizzy at first, but it should pass.
I have a terrible toothache.
Which tooth is it?
This one here.
Yes. There's a big cavity.
Can you fill it?
I'm afraid not. The tooth is too far gone. It'll have to be taken out.
Then I might as well have it done now.
You'd better wait. The gums are swollen. Take the medicine I prescribe and come back in 3 days.
Our mission is to help you learn the English language. We have created easy-to-follow, free educational materials for those seeking knowledge of English.